Hi, this is Dr. A with your medical terminology video on the diagnostic procedures of the urinary system. Let's start with a clinical lab test. So the albumin to creatinine ratio, it's a urine test that measures the amount of albumin and creatinine present in urine. An increased ratio indicates disease. Blood urea nitrogen, or BUN, is a blood test that is used to evaluate kidney function by measuring the level of nitrogenous waste in the form of urea in the bloodstream. And so these are waste products from protein metabolism. The clean catch specimen is a urine sample that's obtained after cleaning off the urinary meatus and collecting the sample midstream. So that means you start peeing and void a little bit of urine and then try to catch what's the midstream, basically, of the urine flow. Creatinine clearance is a test of kidney function. The amount of creatinine in the bloodstream is compared to the amount in urine. And the volume of urine produced in a certain amount of time, usually 24 hours, is also measured. And all of these go into a calculation that calculates how much urine is produced in milliliters per minute. The estimated glomerular filtration rate, or the eGFR, is a test to measure the kidney function. It measures the level of creatinine in urine, and so it uses the creatinine level to estimate the glomerular filtration rate, and the creatinine is a waste product of creatine kinase, which is related to muscle and muscle mass. Urinalysis, UA, written either U/A or UA, is the physical, chemical, and microscopic examination of urine. It is a clinical lab test. And urine culture and sensitivity, or CNS, is a test of bacterial infection. It attempts to grow the bacteria on a culture medium in order to identify it and then determine to which antibiotics it is sensitive to. And this specimen that is set up here would be a urine, obviously. We can do culture and sensitivity on a lot of different types of specimens. A urinometer is an instrument to measure the specific gravity of urine. A diagnostic imaging, so we're going to look at a cystogram. It's an x-ray record of the bladder. Cystography is contrast dye is placed in the bladder, and then an x-ray is taken, and it outlines the bladder. Excretory urography, a dye is injected into the bloodstream, and then the x-ray traces the dye as it moves through the organs of the urinary system. An intravenous pyelography is injecting a dye into a vein and then taking an x-ray to outline the renal pelvis. So we're trying to get the pelvis into the ureter around the kidneys there. A KUB, or kidneys, ureter, and bladder, is an abdominal x-ray that shows the kidneys, ureters, and bladder. A nephrogram is an x-ray record of the kidneys. A pyelogram is an x-ray record of the renal pelvis. Retrograde pyelography is when dye is inserted through the urethra to outline the bladder, ureters, and renal pelvis. Voiding cystourethropy is when dye is placed in the bladder and then the x-ray is taken to visualize the urethra while the patient is voiding or peeing. And so here is an example of an image of a retrograde pyelogram x-ray. So the opaque dye outlines the bladder, the ureters here. You can see a little bit the urethra right there too, and then the renal pelvis right there, and then we can see the right kidneys also. The ureters do appear normal on the right, but on the left there's a problem here, right there. So yeah, that is pretty cool. And then lastly, for our endoscopic procedures, a cystoscope is an instrument that is used to visually examine the urinary bladder. It's inserted through the urethra. Cystoscopy is the visual examination of the urinary bladder using a cystoscope, and a urethroscope is an instrument that is used to visually examine the urethra. So there you go. That wraps up all of our diagnostic procedures for the urinary system.